About 5.2 million people in the U.S. had Alzheimer's in 2014, and that number is expected to roughly triple by 2050. There is still no cure or particularly effective treatment for the disease, and now healthy 30 and 40-year-olds who have some family history of dementia are increasingly consulting with doctors on Alzheimer's prevention strategies. Max Lugavere is one of those unlikely patients. He joins me now, along with the Wall Street Journal's Reddy. Thanks to both of you for being here. Max, let me start with you, because you are very healthy. You have no problems to speak of, but yet you do have a family history of Alzheimer's. Tell us about your personal experience.
Yeah, so it was a couple of years ago that my mom started showing signs of cognitive difficulty. And, you know, it sort of awakened me to this idea that if there's steps that I can take today that can, allay or completely prevent, any sort of onset of cognitive difficulty or anything, then I was going to take those steps.
But Sumathi, that's sort of the problem here, right? There are no clear steps that anyone can take, correct?
Well, there have been studies that have shown that various lifestyle interventions could reduce your risk, but a lot of the sort of big names in the field think there needs to be more research done before, we can have prevention plans.
And so, Max, what are the steps that you're taking under the guidance of a doctor, correct?
Yeah, well, I mean, we do know that one of the most powerful things that you can do for your brain health is physical exercise. I've read studies that show that, just doing aerobic exercise can actually cause the memory center of the brain, the hippocampus, to grow by 1% every year, which is not something that any known drug has the potential to do. We know that diet affects brain health for sure. It's definitely a nascent science, but there have been recent studies to show that that Alzheimer's is actually a form of diabetes of the brain. That's a really powerful idea, because type 2 diabetes is essentially a lifestyle disease.
And so what are you particularly doing? What is your regimen?
Well, I really enjoy exercise, and I try to eat as sort of low carbohydrate a diet as I can, generally low sugar. I think that's the most important thing, because I think that, having insulin levels in your body, which is basically the hormone that tells your cells that there's sugar in the blood, having those sort of be a roller coaster is not good. I mean, that's what ultimately leads to insulin resistance, which is the hallmark of type 2 diabetes. So, I think it's just a fascinating time. We're learning a lot about brain health, and so I like to sort of track that stuff.
And so, Sumathi, does it sound like Max is on the right track?
Well, actually, Dr. Isaacson was very impressed with Max and his regimen, and he said there's only a few additional things he should be doing in order to optimize his brain health. So he was kind of considered the ideal patient.
And what would those extra things be?
One of them was adding cocoa powder to his diet, and I think the other one was reducing his fat intake, his saturated fat intake a little bit, increasing protein. And
so, Sumathi, where do we stand in terms of finding a cure for Alzheimer's? Is it something in the very distant future?
I mean, there's ongoing trials, ongoing prevention trials, as well as, testing of drugs, but I think, it's the holy grail that no one really knows. I mean, as Dr. Isaacson says, this will be a totally different disease in 10 to 15 years from now. So, now's the time to sort of start your prevention.
So now, in the short term, we should all be doing what Max is doing. Max, thank you so much for being with us today. Sumathi, thank you so much for that.